Good evening. My name is Beatrice Soto, and I am going to talk about high blood pressure, also known as hypertension. What I have in my hands in front of me is a blood pressure cuff. This is a manual cuff that can help measure your blood pressure. They also have electric blood pressure cuffs, which are easier to read. But anyone will do. It is important for individuals to monitor their blood pressures and get regular checkups. Having blood pressure is the measurement of the blood force against your artery walls. Having too much blood forcing your artery walls and your arteries getting narrow will contribute to high blood pressure, also known as hypertension. The normal blood pressure would be between 115 to 120 systolic, which is your heart working, and your diastolic, which is your heart resting, would be 75 to 80. And the good thing about your blood pressure or having any issues is that it's easy to detect having high blood pressure. If you go to your regular checkups, at the doctor's office, that is one of the steps they do is take your blood pressure. With high blood pressure or hypertension, it is called the silent killer because 1 out of 4 Americans have it and do not know that they have high blood pressure because they don't experience any symptoms. But others will have symptoms, and the symptoms that they will experience would be headaches, dizziness, or even nosebleeds along with other symptoms. The risk factors for high blood pressure or hypertension could be age, which are more common in middle-aged individuals. Men tend to have high blood pressure more than women. Women will have high blood pressure more likely after they reach their menopause stage. Race, African Americans tend to have more complications of hypertension, family history, and tobacco use. Also, our diets. Having too much sodium, which is salt intake, retains fluid, which makes the heart work harder to get all the blood around our body. So that also will contribute to high blood pressure. Stress and chronic conditions such as renal failure, sometimes diabetes will also be cause of high blood pressure. The complications with high blood pressure could be heart attacks, strokes, and even death. Some people have died with high blood pressure and didn't even know that they even had high blood pressure. So it is very important for an individual to understand the importance of getting a regular checkup and knowing if they have high blood pressure to get proper treatment. It is very easy to treat high blood pressure. High blood pressure can be treated with diet. High blood pressure can be treated if somebody is obese, losing weight. Exercise, a daily exercise helps treat blood pressure. And also medication. Certain medication can help reduce your blood pressure readings. So any other questions, it would be really important for somebody to talk to their primary care physician so that the primary care physician can answer all their questions that need to be answered. And if they are experiencing high blood pressure, then they could also have a treatment prepared for them, because each individual is different and each person will have a different treatment. Thanks for spending the time listening to my speech, and if you guys have any questions, I am willing to answer. No questions? Thank you very much.